It's Dr. Karen Can, and I know that you are anxiously awaiting for the next LifeWave micro training with me. I'm just kidding. Anyway, so today is a quick video to share with you a nifty little protocol for pain in the back of the knee. Now, a lot of people have knee pain, and it doesn't really matter what the diagnosis is. So it doesn't matter if you've been labeled with osteoarthritis or rheumatoid arthritis or Baker's cyst, which is swelling in the back leg. It doesn't really matter. What we're doing is treating the symptom of pain and swelling. Now, you may have pain and swelling, or just pain or just swelling, but try this out and see if it works for you. So the point we're going to use today with our patches is the Bladder 40 point. So the Bladder 40 point is on the back of the knee. So I'm going to share my screen and show you where that is. So just hang on just a moment. Okay, here we are. So this is a Bladder 40. Let me make that bigger. So thank you, Big Tree School of Natural Healing, for this awesome photo. So where is Bladder 40? Well, the actual point is in the crease of the knee, at the back of the knee, and it's pretty much in the middle. So it's in the middle of these two tendons on either side. These are the tendons for your hamstring that go on either side, and it's kind of in the middle. Now, putting a needle back there is one thing, but putting a patch there is something different, and it could be uncomfortable if you are bending your knee a lot during the day. You know, if you're bending down and squatting, you know, sitting with your knee bent, which, by the way, is not the greatest idea, having your knee too much bent. I'll talk about that in a moment. So instead of putting it the patch in the middle of the crease, okay, what you're going to do is put it slightly below or slightly above, so that the edge of the patch might graze the crease a little bit, but not enough that when you bend your knee, it's going to bother you, right? Because the patch, if you bend it in half, the edges could poke at you. Now, some people don't mind at all. It doesn't bother them. They can sleep with it. Great. But at the back of the knee, if you get swelling in the back of the knee, especially if it's swelling from inside the joint, they call that a Baker's cyst. So it's just more of a descriptive term than anything. So you might notice a bulge at the very back. So don't be scared about that. Of course, get it checked out by your healthcare professional and all that kind of stuff. But as far as treating the swelling and or pain that may come from it, one of the things you can do is put patches on the back of the knee. Now, you may ask, well, which patch do I use? Well, I'm going to give you two options. There are multiple options, but two options that are more than likely going to be helpful. The first is using LifeWave. So LifeWave is a patch that has a white and a tan. So each package has a white patch and a tan patch. And there's like 15 sets of these. And what you're going to do here is put the white on the right and tan on the left. So you're just going to place it either above or below Bladder 40. And in your mind, you're going to make that intention, I'm patching Bladder 40, because it's a very powerful point for the back of the knee. Okay, so the cool thing is your intention does help with anything that's energetic in terms of any sort of healing tool or things like that, or wellness tool. Energy can be helpful in the form of thoughts and intentions. So you're just going to say to the body, I'm patching Bladder 40. So you're going to take white on right, tan on left, and you're going to patch on the back of the knee. And remember, you have to drink lots of water for the LifeWave to work well. That particular set of patches is particularly sensitive to your hydration. So for the best pain relief, you want to be as hydrated as possible. So don't drink all at once. Drink short, small amounts of water slowly throughout the day, and that's really, really helpful. Like, you know, a couple of gulps at a time, or a couple of sips at a time, you know, multiple times an hour. So if you're fully hydrated, you would put the LifeWave here. Now, if for whatever reason it makes the pain worse, all that means is that you need to change the polarity of the patches, meaning that the white patch now wants to go on the left, the tan on the right. Normally it's white on right, tan on left. But when you're talking about pain, the polarity can change in and around your skin area. So you can definitely patch the opposite. So try it out and see which one works better for you, the white on the right or the white on the left. So the first protocol is using LifeWave on the back of the knee. The second protocol is actually, if you don't have LifeWave or prefer something different, you can actually use the Aeon patch, AEON. The Aeon patch is helpful for stress and inflammation. So how that works is, in this case, since we have both knees affected, I would actually recommend you put an Aeon patch on each knee. Now, normally you're like, well, don't we usually use one? Well, you can just use one if you want. But in this case, in this protocol, we're going to put an Aeon on the back of each knee and an X39, which is the stem cell enhancing patch, somewhere in the center line. So that could be below the belly button, as in the brochure, or it could be in the low back area. Okay, hopefully you can see my mouse here, in the low back area. So then you're creating a really nice energetic triangle, whether that's, X39 on the front or the back. You can even put it on the back of your neck, which is another brochure point. You make a bigger triangle, and sometimes bigger triangles have bigger effects. Now, if this is uncomfortable for you, the bladder 40 point, you could put that lower on the leg. There's a point down here at the base of the calf, where the calf comes into a little pyramid. This is called bladder 57. You could actually put either your LifeWave or your Aeons at that point, if for whatever reason it's really uncomfortable there. That's another strong point to use for pain in this area. So bladder 40, great point, acupuncture point for pain and swelling in the back of the knee. Just to summarize, LifeWave, white on right, tan on left, or white on left, tan on right, whichever works better. And then use an X39 on the center line, optional. Either higher or lower in the body. In the brochure points, doesn't really matter. It's whatever works. And the other option is, again, using the X39 in the center, but using Aeon patches on both sides. And so if you have back of the knee pain, try these two. And please post somewhere near this video in the comments how that works for you, or whether you're going to try it. So yeah, let me know in the comments. Number one, if this is helpful. Number two, if this is something that you have that would be helpful and you're going to try it, please let us know how it works for you. So that's it. The LifeWave micro training. We have a whole host of micro trainings that are absolutely free that you can share on the YouTube channel. And that playlist is called LifeWave Micro Training. So I hope you've enjoyed this. Please feel free to share with whoever else is maybe suffering from this particular symptom. And if you're not currently a LifeWave distributor or customer, whoever shared this video with you, you can get back to them if they happen to sell or distribute this particular product. Or if you don't have anyone and you're just seeing this because you're on my channel, you're more than welcome to contact me as well, or my team members at patchtrainingteam.com. We have a free gift for you, which is the free brain balancing protocol that you can download, a PDF. It's actually a whole chapter of my best-selling book, Guide to Healing Chronic Pain, A Holistic Approach. And that whole chapter is now the new brain balancing protocol gift when you go to patchtrainingteam.com and join my mail list. So enjoy and have a wonderful rest of your day. And remember to subscribe to my YouTube channel as well. Thank you.